well, but I actually find that telehealth inpatient is a lot more efficient than telehealth outpatient. You see what I'm saying?
Okay.
So, and I actually think it's more a more there's more utility in it. And what I mean by that is in the outpatient setting, if I have a sick old grandma that's 70 years old, and she's and this is a clinic setting. I'm not able to connect with her as well because she's not familiar with the technology, but also I don't have access to her physical exam. I don't have access to her vitals and maybe not even recent labs or even know what medication she's on. But in the inpatient setting, in the hospital setting, she's essentially in a controlled setting, right? That 70-year-old grandma is in a controlled setting where I have access to labs, x-rays, vitals, physical exam by the nurse. So I think in the inpatient setting is even more useful, and you get more out of it than in the outpatient setting. Now in the outpatient setting, I'm not opposed to outpatient, but oftentimes you need a select patient. You see what I'm saying? Relatively stable, doing well, and oftentimes the people with multiple comorbidities. Let's just say a grandma's coming in or a grandfather's coming in, short of breath, leg swelling. You kind of need that physical exam in the outpatient setting to really assess them if they need, what's going
I
on.
would agree.
But
Now,
in
if we have a nurse practitioner or a nurse at the clinic where they're walking into where we have active vital signs, they're able to obtain the chart, send it over to you for review. I would say that that would work. But I would
Yeah,
agree that if you're going to do it in an outpatient clinical setting, the method behind the madness and how you set that clinic up has to be very intentional
yeah,
for that to be successful. I would
yeah,
completely agree
absolutely.
with
Now, if
that.
they're
Yeah,
stable grandmother, nothing's going on and everything's fine, it's
even
fine.
better, right?
Yeah, yeah. But the more difficult patients, I think for difficult patients, inpatient
Inpatient.
telehealth is fine. So
Absolutely. Agree.